I reckon I will start so I can pass over to our fantastic panelists for today. Good morning, afternoon, and evening, and welcome to this webinar named Synthetic Storm, Confronting a Global Crisis of Illicit Fentanyl and Emerging Drugs. My name is Regina Mattsson from WFAD, and it's my honor to open and moderate today's session. For over 2 decades, the United States has been the epicenter of a devastating opioid crisis. Sparked by overprescription and aggressive pharmaceutical marketing, the crisis has claimed hundreds of thousands of lives. Today, the crisis has evolved. Illicitly manufactured fentanyl and other synthetic opioids are now the primary drivers of overdose deaths in North America, with fatal doses measured in mere milligrams. The ripple effect of the synthetic storm is now being felt far beyond the US borders. Across the Atlantic, Europe is facing early warning signs. Although the continent has not yet seen opioid mortality on the scale of the US and North America, analysts fear it may be sleepwalking into a similar crisis. The 2022 Taliban opium ban and the disruption of heroin routes may destabilize Europe's traditional opioid supply chain, and these disruptions raise concerns that synthetic opioids could fill the vacuum. The threat is not hypothetical. In 2023, spikes in nitazeene-related overdoses were reported across Europe, from Ireland to France to Latvia and Estonia. Evidence shows these substances are already present, often hidden in counterfeit pills, contaminated heroin, or unregulated prescription drug markets. Yet gaps in testing, detection, and data collection mean the true scale of this silent spread remains unknown. In some countries, fewer than half of overdose deaths receive full toxicological analysis. Meanwhile, in the Middle East, a different but no less troubling transformation is underway. The rise of captagon production and trafficking has destabilized drug markets across the region, with political transitions unfolding in Syria and economic strains in Afghanistan following the opium ban. The landscape is rapidly shifting. These dynamics risk accelerating the spread of synthetic alternatives. Globally, synthetic drugs are reshaping the illicit market. According to the most recent UN World Drug Report, synthetic substances now make up nearly half of all the global drug seizures. This includes not only opioids, but also synthetic stimulants, benzodiazepines, and new psychoactive substances. These drugs are cheaper to produce, easier to traffic, and far deadlier than the traditional plant-based drugs. Yet, amid these complex trends, one truth remains, and that is that the harms of the synthetic drugs are not inevitable. With timely, science-based, and evidence-driven drug demand and supply reduction, global cooperation, and improved surveillance, much of this devastation can be prevented. So today's webinar brings together global experts to explore these challenges as well as the solutions. We'll hear about the rapidly evolving scope of the synthetic drug crisis, the devastating impact it has on individuals, families, and nations, and most importantly, how we can act through promising approaches to counteract these developments. So together, we can understand what's working, what's missing, and how we can act both collectively and urgently to meet the synthetic storm before it breaks. So for today, our first 2 speakers will have 20 minutes each, and after that, we'll be joined by 2 shorter remarks. We will save the questions and comments for the end of the session, but you're most welcome to write in the Q&A box, in the chat, and if we have time and the time permits, we could raise some questions after the speaker. So without further ado, our first speaker, Mr. Sean Ferns, serves as the Chief of Community Outreach and Prevention Support for the DEA and has done so since 2015. In this capacity, Sean is responsible for guiding a diverse and creative staff to develop and implement strategic national drug education efforts and partnerships with other organizations at the federal, state, and local levels in the US. These partnerships and initiatives help educate the public on the current drug threats facing the country, support the DEA field offices, implement DEA's Operation Engage, communicate key administration drug prevention messages, and help reduce demand for illegal drugs. Thank you so much for taking the time to be here with us today, Sean, and I'll hand over to you.
Regina, thank you very much. And let me start by thanking the World Federation of Drugs and the Drug Free America Foundation for the invitation to join you today. To all of you joining from around the world and here in the United States, I bring you greetings. On behalf of the nearly 10,000 women and men who make up the United States Drug Enforcement Administration and our new DEA administrator who just took over here just last week at DEA. I'm going to make comments that are fairly focused on the effects of synthetic drug trafficking and drug use on the United States, but certainly DEA is no stranger to the international realm. We are in host countries around the world working with host drug law enforcement entities, as all of you know, and we value tremendously those international partnerships. We know that the drug issue is not solely an issue for the United States, but that all of us working together can ultimately have a greater impact than any one of us working alone. So, synthetic drugs. First of all, let me start by talking about what our source of information is for this presentation. Every year, DEA produces and releases a national drug threat assessment. I will add a caveat that word national, it obviously applies to our primary audience of United States citizens, but certainly the publication speaks to the global nature of drug trafficking and drug money laundering. I would encourage each of you, if you have not downloaded a free copy of this publication, it is available on the DEA website. The newest edition, the 2025 edition, came out just about 2 months ago now, 2.5 months ago. So it's fairly fresh. When we talk about the impact of drugs on the United States, we talk first and foremost about lives. These are some sobering statistics, and there is good news, but that does not mean we take our foot off the gas pedal and slow our momentum. This is data from CDC here in the United States for the 12 months ending in February of 2025. We lost just over 78,000 Americans to a drug overdose or drug poisoning. The other major risks to unintended death, suicide, firearms, and car crashes in the United States, nothing comes close. Again, good positive news that this number is down dramatically over the past year, 25% down. That's great. It is moving in the right direction, but I don't think anyone would say that the loss of nearly 80,000 Americans is good. In fact, we are losing far, far, far too many Americans every day. The top synthetic threat for us here in the United States, and what Regina mentioned as a potential growing threat to other nations, is fentanyl. It is incredibly deadly. It is a very small scale issue as opposed to large amounts of other drugs that are required for an overdose. The amount of fentanyl involved is very, very small, as we all know, 2 milligrams. The fact is that we are losing in America 214 folks per day to drug overdoses and poisonings. The lion's share of those losses are due to fentanyl and its analogs. The amount of fentanyl that DEA, just DEA, not any of the other federal law enforcement entities across the United States, but just the amount of fentanyl that DEA seized in the United States last year was enough to kill every single American. The fact remains that the overdose crisis is a clear and present public safety, equally importantly, public health, but also a national security threat. So when we talk about synthetic drugs like fentanyl and its analogs, we talk about how it's threatening our population. And the reality is that fake pills are the number one issue for us here in the United States. DEA analyzes samples from all of our drug seizures, and in fact, many drug seizures that come from other countries and from other state and local law enforcement across the US. And currently, what our forensics laboratories are seeing is that for every 10 pills that are analyzed, 5 out of 10 of those pills, 5 out of 10, so half of these pills that are analyzed, contain a deadly dose of fentanyl. Most of the fentanyl is coming in from Mexico. It is coming in either in powder form or in these deadly pills. It is ultimately a game of Russian roulette for an individual who is taking a pill that wasn't prescribed to them by a trained medical professional and doled out by a registered pharmacist, because again, so many of these fake pills, half by DEA's analysis, contain that deadly dose, 2 milligrams of fentanyl. The issue really truly comes down to whether or not any of us can tell the difference between an authentic prescription drug and a fake. The fact is that drug cartels and their manufacturing operations are very, very good at making fake synthetic drugs from the precursor chemicals. It is very, very difficult. The trained professionals across DEA most of the time can't tell the difference between a real, in this case, 30 milligram OxyContin tablet and a fake manufactured, by a Mexico-based drug trafficking organization. Here's an important update on the seizures and the statistics from DEA. These are as of a week ago. So just in 2025, DEA alone, over 45 million fake pills that are containing fentanyl, over 45 million pills. And again, it's not just pills. It can also be this synthetic powder. And in the powder form, just DEA has seized close to 5,000 pounds of fentanyl powder since the start of 2025. That equates total pills and powder to 196 million deadly doses just on the supply reduction side of the house through these seizures, and again, just by DEA. Let's talk about another synthetic drug that is also very, very challenging and worthy of noting, and that's carfentanil. Carfentanil is a synthetic opioid. It was originally developed for veterinary use. You will see it oftentimes used by veterinarians to tranquilize large animals at zoological parks, like elephants, an elephant tranquilizer. It is estimated to be 10,000 times more potent than morphine and 100 times stronger than fentanyl. How does that relate? If you see this graphic on the screen now, fentanyl is on the left. So we already said a deadly dose of fentanyl is 2 milligrams, barely a little bit of a pile on the tip of a sharpened pencil. On the right, in comparison, is the potentially deadly dose of carfentanil, 0.02 milligrams, so even fewer granules to be a deadly dose. DEA is finding carfentanil mixed with other drugs and also pressed into pills. So again, just in powder, but also in fake pill form. And we have detected carfentanil in 37 states. So it is worth noting that challenge. When we talk about major ports of entry into the United States, obviously a lot of the U.S. government's focus is on the southwest border. This is some data on seizures, again, just in 1 year, just in 2024, across 4 different regions. You'll notice that the border with California, the border with Arizona, significant number of seizures, significant quantities of seizures. Those are in kilograms, over 9,000 kilograms of fentanyl along the border between Arizona and Mexico. We see it across New Mexico and Texas as well. But again, it is a threat. When we look at seizures across interstates, so again, it's not enough to simply bring it into a country, but then you have to move it across the country. These highways that are indicated on this map are the major distribution hubs for fentanyl. Again, the Sinaloa, I shouldn't say again because I hadn't mentioned it yet. The Sinaloa and the Jalisco cartels are the 2 major organizations that control the vast majority of production and supply of fentanyl and its analogs into the United States. And so our law enforcement and our intelligence organizations tracking and seizing and making arrests are looking at trafficking patterns. And obviously our interstate highway system is a major means of moving synthetic drugs. The cartels exploit, for sure, the relative ease of synthetic drug production compared to both the physical and the environmental limitations of traditional plant-based drugs. Synthetic drugs are infinitely easier to manufacture and transport on highways and in airplanes and in semi-submersibles and underground drug tunnels. And yes, DEA has even seized, along with our Mexican federal police counterparts, catapults that try to fling the drugs up and over the border fence into the United States. So when we talk about synthetic drug production, this is the inside of a typical American pharmaceutical laboratory, manufacturing plant. This is where legitimate pharmaceutical products, pharmaceutical opioids, pharmaceutical stimulants are manufactured for closed distribution through doctors and pharmacists to patients. This is the kind of laboratory that we're talking about when we're talking about synthetic drug production today. There is nothing safe, there is nothing regulated, there is nothing clean, but there is sure a lot of great black market chemistry going on in order to manufacture these products. And then we can even have a separate conversation about adulterants, what is adulterated into the products to make it even more potentially deadly. Synthetic drug trafficking is a fairly easy to follow map. It starts with precursor chemicals. For the United States, the largest source of supply for the precursor chemicals used to manufacture fentanyl are coming from companies in China. That is then smuggled or traded into Mexico, manufactured into either illicit fentanyl powder or fake fentanyl pills through those clandestine labs like the one I just showed you on the previous screen. Then it's smuggled into the United States, all different methods that you can think of, and then distributed through local criminal groups who are aligned with the Sinaloa or Jalisco cartels. And then obviously once the money is made, we're talking about then laundering the profits back to the source countries, both for the supply of the drug themselves and the precursor chemicals. As I said, the Jalisco Sinaloa cartels, major dominant threat across Mexico. Very much worthy of the attention that the United States and Mexican authorities are placing on going after these two cartels. But they are not just a U.S.-Mexico threat. These two cartel organizations operate globally. And if you see your country highlighted, you probably already know this, there is a presence of one or both of these cartels in countries around the world as they seek to what? Make money. And it is very much a money-making opportunity. It is not just one drug that DEA is seizing anymore. Polysubstances are becoming the new norm, quite frankly. Drug cocktails are the norm, not the exception. These mixtures are undetectable without laboratory analysis. 1 in 4 cocaine submissions and 1 in 8 methamphetamine submissions to our laboratories reveal fentanyl mixed in. So gone are the days where it's just heroin or it's just meth or it's just cocaine. It's polysubstance. And this gives you a sense, again, just for calendar year 2024, of the mixes of substances that are found in samples. Let's talk about a couple others, synthetics along that we like. Xylazine. This is, again, data just for the year of 2024. Xylazine is a non-opioid sedative that was approved by the Food and Drug Administration, but for veterinary use. Okay, veterinary use. Increasingly, it is found in the illicit drug supply. The percentage of powder fentanyl and fake fentanyl pills containing xylazine has risen steadily in the United States since 2020. Typically, though, we see xylazine in powder seizures. That's typically where we're seeing it. But again, I hope you picked up on my comment earlier that it is a non-opiate sedative. So the problem with that is the deployment of naloxone for overdose reversal for opioids doesn't work on xylazine. So we're keeping a very close eye and sharing data with our state and local counterparts about laboratory analysis of seizures in xylazine. Now then, let's talk about nitazines, another category of synthetic drugs that's on DEA's radar. These are synthetic opioids, okay? They're similar to fentanyl, but here's the challenge. They can match or surpass the potency of fentanyl. There's no rhyme or reason. It all depends on how it's manufactured in those clandestine laboratories. Nitazines were first developed in the 1950s for pharmaceutical research, but never approved in the United States. Since 2019, nitazines have been seen in tablet form, but also appear in fake pharmaceutical pills like fake Oxy 30 milligram tablets. Uh, Let's talk about psychostimulants. For those that are not familiar with that term, what am I talking about with psychostimulants? We're talking about meth. This is data, again, from CDC. The number of overdose deaths due to meth have been climbing. They are not at the same rate as fentanyl, but as a synthetic drug, if those that thought that methamphetamine went away when Breaking Bad was no longer on the televisions, think again. Methamphetamine remains a potent threat. Here's a new development for everybody who thought, well, methamphetamine is only an issue if you're smoking or injecting it. The DEA and our local and state counterparts and other federal agencies are seizing fake pills that are also laced with meth. So it's not just fake fentanyl pills, but also fake methamphetamine pills. Since January, since January, DEA has seized 70,000 pounds of meth and 3.3 million fake meth pills. Okay, that's a 25% increase in seizures over last year. So there is a lot of product out on the market. Just really quick before I wrap up, narcotics distribution for these synthetic drugs has increasingly become digital and virtual in the internet and dark web. Both traffickers and suppliers and individuals looking to purchase these products use various digital payment methods, cash apps for their transactions. They are using delivery services that are fairly common or fairly uncommonly known to be affiliated with drug trafficking. Who knew that you could order drugs through Lyft? But that's just one example of many, many different types of gig companies that are used for delivery of drugs. And then obviously the fact that folks are using online personas and avatars to do transactions that are oftentimes not using their real names or their real faces or their real photos, and they're not trackable. So obviously that's a bigger threat. Another big threat for us here in the United States is the online access, particularly for youth. Social media used for marketing these synthetic drugs and selling them. Obviously, oftentimes not even using real words, using emojis, the language of emojis to transact for synthetic drugs is a real threat, obviously, for any country in the world where individuals have access to cell phones and those apps. So we have top drug priorities here in the United States from the Trump administration. There are 6 pillars of this effort. Many are focused on supply, and they're also focused on the public health and the demand side. I highlight for you one that we find particularly important, and that is to prevent drug use before it starts. Prevention, prevention, prevention. That is what our office is all about. And I will simply say that you can find out more on DEA's top drug threats on our website. I ask you to consider sharing our One Pill Can Kill campaign. It is a universal message across the globe that if you are taking a pill, only take a pill that was prescribed for you by your doctor, filled by your pharmacy. Anything else could be fake and could be deadly. It translates culturally across the world. Here is my contact information if you want to take a screenshot of that. Regina, the slides that I've shared with you today are perfectly in the public domain, and you can share this contact information with everybody following the webinar. And then one final comment, please take an opportunity to take, steal, repurpose, share DEA's drug prevention and awareness materials. They cut across any number of different synthetic drug types, all science-based and evidence-informed and available at no cost to the public. Regina, I will end there. I think I've gone a couple of minutes. No, actually, I'm not over time.
You're perfect on time.
Okay, back to you. And I'll be happy
Well,
to take questions at the end. Thank you.
oh, perfect. Yeah, I have 1 or 2 questions actually for you that popped up now. But thank you so much. I mean, not only for showcasing, the reality of the situation, but also doing it so visually. It's very good to see these very small doses and how deadly they are, and also to learn a bit more about this interconnectivity, not only of, on the global scale, showcasing how we see that this very real problem in the US and North America really has a global scale, and these connections are seen across the globe. And I'm sure that we'll hear a bit more about that in other countries, but also this interconnectivity between the gig economy, social media, and online payment methods. And for me, my mind is screaming youth, 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 because those are also the areas where youth are employed, youth are engaged, and where they're, met. So I think that's great. Thank you for showcasing that as well. And I'll give you some questions on that later. Thank you so much. And without further ado, it is my pleasure to introduce our next speaker for today, Dr. Musa Daoud, who is the president of the Jordanian Anti-Drug Society in Jordan. He's a member of the Jordanian Commission on Drugs and head of the Arab Network for Drug Control. Dr. Daoud is a pharmacist since 1997 and has an MBA in sales management and marketing. He is an expert specialized in NGO affairs, a member of the Vienna NGO Committee, the IFGC, and a very dear friend to us here. So it is my true pleasure. Let's see, I'm highlighting you for everyone now to hand over to you, Musa. Thank you for being here. Hello.
Thank you, Regina. Good afternoon, good morning for you in the States, and good evening wherever you are, everybody. I would like to begin my sincere thanking Sean for his remarkable and comprehensive analysis and presentation. He has covered many key aspects in great detail, and I will do my best not to repeat what he's already been so clearly outlined. In my presentation, I will focus specifically on the Middle East. However, it is important to recognize that this is not a challenge unique to our region. Around the world, countries are facing similar pattern and alarming rise in synthetic substances. The spreading of clandestine laboratories and devastating impact on public health and safety. So let me start sharing my screen. Could you please confirm that my presentation is online?
Yes.
Brilliant.
Perfect.
So thank you, Shan, for your comprehensive presentation. But let us see that this threat is not theoretical. It is already here. We are seeing a sharp rise in synthetic drugs across the Middle East. They harm young people, overburden health system, and even finance armed groups. Let's explore what's really happening. And I would like to start with Captagon, perhaps the most notorious synthetic drug in our region. It is cheap, made in Syria and southern Lebanon as well. Perhaps the most common issue between Syria and Lebanon is the chaos of security, and it is trafficking across the Middle East, with Jordan and Lebanon as a key transit points. With that, it's even used by militias to energize fighters or fund operations, which make it really a tough area for us in the Middle East. But Captagon is not alone. We are seeing methamphetamine, crystal meth, known locally as a shabu. It is a part of Iran and Iraq. In Jordan and Palestine, synthetic cannabinoids like Joker are harming users, especially the youth people, and those in refugee camps and refugee cities, which really are very difficult for us to deal. So from the conflict, in many ways, synthetic drugs have become a war economy. Militias and armed groups using drug production to finance operations. Clandestine labs are hidden in conflict area where enforcement is impossible. This is what makes the issue so complex. It is just criminal. It's not only just criminals, it's political as well in our region. And in our country, Jordan, heavily impacted. We have seen a surge in synthetic drug seizures in our northern borders. Unfortunately, drugs are also being consumed locally, often by youth in vulnerable communities. These drugs are not just dangerous for user. Clandestine labs release hazardous chemicals into environment. Hospitals are seeing more cases of psychosis, violent behavior, and overdoses. And unfortunately, we don't yet have tailored treatment for many of these substances. Why? Gaps, of course. Our region still lacks the tools to fight these growing threats. There's limited coordination between countries. Very few mechanism for tracking chemicals used in drug manufacture, and not enough awareness among families, schools, and even professionals. What can be done? We need to act now, as Regina mentioned, through smarter coordination, better intelligence, investment in prevention and recovery, and especially by protecting our youth from exposure to these drugs. I would like to close. I would like to remind us all, this is not a battle against chemicals. It's a fight to preserve the health, dignity, and future for our youth and our nations. Thank you all, and I look forward to your question at the end of the session. Thank you, Regina.
Thank you so much, Musa. This was a great presentation and showcasing really the both criminal, as you said, and political aspects of this issue, but also the consequences for youth, for vulnerable populations, but also for the environment, which the most recent World Drug Report also highlighted a bit more on. So it's something that we're looking forward to learning more about in the years to come. And thank you also for providing us a list of ways forward. I think that's where we'll focus our discussions at the end of this session of what we can do together, to counteract this. So thank you so much, Musa. And without further ado, I'd like to introduce our next speaker, Mr. Sana Ratore, a seasoned professional. Let's see, let me spotlight you, Sana. A seasoned professional with over 2 decades of experience in drug demand reduction and the founder of the Pakistan Youth Organization, equipped with a master's in sociology and an international certification of addiction professionals. Sana has implemented numerous projects with international organizations and leads various trainings on substance use disorders. Thank you, Sana, for being with us today and providing us some insight on the situation in Pakistan. I'll hand over to you.
Thank you very much, Regina. And I am really grateful that I just sent email that I want to share something from Pakistan that is a very important topic. So I would like to share that with Pakistan, if we talk about the Pakistan faces a rapidly escalating synthetic drug epidemic. So number of the deaths due to overdose of the synthetic drugs reported in Pakistan nowadays. And another thing that is a very alarming situation that the synthetic drugs have become alarmingly normalized in the educational institutions. That is very important that about the 53% of the students exposed to drugs nationally, and especially if we talk about the elite private institutions are particularly affected due to the students' purchasing power and lack oversight. Another thing that is would also like to mention that despite that the number of seizures done by the law enforcement agencies in Pakistan, but the situation is alarmingly and escalating the synthetic drugs in Pakistan. Today, I just want to share the data of the two rehab centers, uh, which is based in the admission data of the rehab centers. First of all, I would like to share the admission data of one of the rehab center, that is a Freedom Rehab Center, which is based in the Gujranwala. I just try to make it short that if we just talk about the percentage of the drug use of the patient which admitted in the Freedom Rehab, that if we talk about the alcohol, around 15% the patients reported that they're using the alcohol, and 24% about cannabis, and 2.3% is opioid, and 16% heroin, and 27% is amphetamine, especially if we talk about the meth. And the multiple drugs about 14%, and cocaine about 0.2%. And around 27%, so if we talk about the meth. And another data which we collected from the Mia Afzal Trust Hospital in Pakistan, that is a very alarming that similarly the patients reported that they're using the alcohol about 2%, and cannabis of around 1%, and opioid around 5%, and heroin about 6%, and opium around 1%, and meth around 44 and 44.9%. Yeah, it means around 45% drug users using the meth. And if we talk about the multiple drugs which the people, drug users using, that around 37%. If we made a comparison from last 2 years, if we talk about the before 2 years, that is around 30 to 35% the drug users use the popular drugs among the drug users are the heroin, and then around 25 to 30% is cannabis. And today, as I mentioned, share the data of Mia Afzal that around 45% the drug users using the meth. That is, I think, that is an alarming situation, and it's also raising the day by days when we see the treatment admissions data in the different rehab centers. So that is a few information which I just collected today, and I would like to share with this esteemed panel and also the attendees of this webinar. So thank you very much, Regina, and Drug Free America Foundation and World Federation Against Drugs for providing me this opportunity to share the present situation in Pakistan. Thank you very much.
Thank you very much, Shana, for coming on and giving us this great presentation as well. It's great to be able to take part of this very newly collected data that you have. It's great to hear about the situation in Pakistan and in other parts of the world. So if you're sitting in the webinar and thinking this is the reality of my country, please do share that in the comment section or the Q&A, and we can make sure to read that out loud, or we can have a discussion about that. Now we're getting ready to go into the questions and answers, and we do have a question in the Q&A session here. It says, the question is, please explain more about the international route like Mexico to Turkey, Kenya, Belgium, and New Zealand, and also about Afghanistan. Afghanistan already diversion from opium to ice meth making. I think possibly Sean, this one's for you as you showcase the map of the routes. Would you like to say something on this?
I can talk about it. I wish I had known that this question was coming. There's a graphic that I could have shared that I have on another computer that obviously maps the global drug trade. Obviously, the trade is ever evolving. I can speak to you about, regardless of the drug of misuse and abuse, for the United States, the lion's share of precursor chemicals, again, whether it's fentanyl or fake pills, come from China, and to a lesser extent, some from India, but the vast majority from China. Then it is smuggled across the Pacific through a variety of means, both legal and illegal, to Mexico, and then brought north across the border. Cocaine is coming up from South America through Central America and the Gulf and the Pacific to the United States. Over the years, we saw an evolution of drug trafficking from, particularly after the terrorist attacks of September 11th, when U.S. borders got tighter. Drug traffickers switched to focus on Europe and Asia. And DEA had to open offices for the first time in some African countries because Africa became a stop-off point and hub for regional distribution of drugs coming from South America into Europe. So needless to say, the reason that DEA is in 70 countries around the world is that we are working to stop the supply of drugs before they reach the intended audience, the intended population. But we have to acknowledge the significant money that can be made from the sale of illicit substances, and therefore the ever-evolving trade routes and drug routes. When you push down on one end of the balloon, it'll pop up somewhere else. It reinforces, if I may switch a little bit, it reinforces to the topic of to Musa's comment earlier in his presentation, raising awareness and preventing substance use in the first place in order to starve the market by not having as great a demand in any country. But again, I will send through Regina a global map of drug routes, but just know that it is a snapshot in time and it truly is ever evolving. But there is no place in the world that is untouched by global drug trade. It is just simply a nature of the global business, and how synthetic drugs in particular are so much easier to traffic because of the size amounts that are involved. Thank you, Regina.
Thank you, Sean. I see Musa, you come back. Do you want to add something to this?
No, it's okay.
All right, so then,
I'm ready.
okay. So Sean, I was actually wanting to keep you on here because I wanted to ask you a bit about the work that you're doing at the DEA in terms of drug demand supply reduction. If you have any certain programs or partnerships that you would like to highlight.
Yeah. I'm going to mention a couple of things that I would love for folks to dig in a little bit deeper on as you have time to go to a couple of different websites. 40 years ago, 1985, DEA lost a special agent named Enrique Camarena. He was working in Mexico investigating drug trafficking organizations there. The drug trafficking organizations kidnapped, tortured, and murdered him. One of the things that DEA did as a result of that horrific event 40 years ago was to stand up this effort that my very, very talented team of folks across the United States helped to coordinate, which is to enlist the help of every American to raise awareness about the top drug threats that are facing our citizens today, and to make sure that they understand that the best way to grow up, and that the vast majority don't use drugs, right? So the vast majority, at least in America, the vast majority do not, and that's social norming. But to spread that awareness. So our work, the E in DEA is enforcement. Okay, that is our first and foremost primary priority mission, is to go after the drug trafficking organizations. But where DEA can make a difference in the community, in the communities that we operate in, to help raise awareness, to use that shiny gold badge to get people's attention and say, hey, folks, methamphetamine is an issue in your community. Fentanyl is an issue in that community. Cocaine is an issue in this community. And to use science-based proven prevention methods to get people's attention. That's important. So I mentioned earlier in my presentation, the One Pill Can Kill campaign. Anyone across the globe can take a look at that and say, you know what? The issue of fake pills laced with other drugs that shouldn't be in those fake pills is a problem in my country. We could institute a One Pill Can Kill campaign in our community. And that is not, by the way, scare tactics. People, when we first launched it 3 years ago, said, why are you trying to scare everybody? Well, the reality is, it is scary facts. The facts are that these pills are out there laced with synthetic drugs and are available. So that's one item, dea.gov/onepill. Amy Ronhausen, thank you so much for sharing the website in the chat. Another resource that any country around the world could emulate is our national prescription drug take-back efforts. Twice a year in April and October, we host locations across the United States where people, average citizens, can bring and dispose of unused, unwanted, or expired prescription drugs. Most of them are going to be opioids. The reason that's important is that science shows that prescription drug misuse can lead to other opioid misuse and even to addiction, and that following the chain of substance use disorder, prescription pill opioid misuse could lead to heroin, which could lead to products that are laced with fentanyl, and increasing along the way the chances of a poisoning or an overdose. So deatakeback.com is a website for you to learn more about how we manage the prescription drug take-back events. Our next one, again, is on October. We do one in April and one in October. We have a number of publications that, again, are science-based and evidence-informed that we try and push out through partnerships like our long, strong partnership with the Drug-Free America Foundation and other nonprofits around the United States. We all are probably familiar with the behavioral health continuum from the Institute of Medicine, and we know that the very beginnings of that continuum start with universal awareness and support for prevention. And that, you know, those powerful messages of growing up healthy and drug-free are what more and more and more citizens need to hear, particularly as the drug supply gets increasingly deadly with more and more synthetic drugs. Because, hey, there's going to be another chemist who's going to develop another synthetic drug and mix it with the rest of the supply. And ultimately, we must do more to lower demand.
Thank you so much. Great, great answer, and really important as well what you're highlighting about the programs that we're doing to be science-based or science-driven, and they are in truth very scary facts. So thank you for highlighting the programs that we could contextualize into our respective countries. We have a question about defining all synthetic drugs in the chat box. I think maybe Amy or Heather, I know that Drug-Free America Foundation has a lot of information about this. Possibly you could send some links in the chat for that, and I will hand over maybe to Musa first and then to Sana, if you'd like to share some of the programs that you would like to highlight and how we can counteract this global threat.
Well, I would like to thank you, first of all, for this opportunity for us to show you how difficult is the work in the Middle East. I think you can imagine how is the situation, especially in the last couple of years during the war and the conflict in Palestine, with the Syria situation, the change of the regime there, the situation in Lebanon, and at the same time Iraqi conflicts. We are in Jordan are surrounded with fire. The region is totally uncomfortable for us as a civil society to work efficiently. In Jordan, we still have a safe country, but we are surrounded with a ring of fire. At the same time, the armed groups in the southern Syria are trying to push as much as possible from those illicit drugs that already have been manufactured during the previous regime, Bashar al-Assad. And until now, the situation in the border is not stable yet. It's not secure yet. They still attempt to transit the situation, not only the illicit drugs to Jordan. So it's really difficult, dangerous to work in such situation. What we are trying to do is to raise awareness about the situation for the people there, for the vulnerable community, especially the refugees, the Syrian refugees who still stuck in Jordan and nearby the borders. We are trying to do our campaign in schools. We have some different kind of campaigns. Nowadays, we have an initiative called Initiate because you are capable. In Arabic, we call it Badir لأنك قادر, which make all the community to initiate whenever they need, initiate to help other people. The peer working with youth. We have our smart club now with the international smart club activities in Jordan, but because of the summertime now there's no schools, but we still work with some summer campaign here in Jordan. We have a different point of view in working, but as I mentioned earlier, that our region has been left behind for decades. We need more support. We need capacity building programs for us in Jordan. We need to be involved with the international movement to learn more about the new strategies, about the new campaigns that we can adjust it to be suitable for our community in Jordan. But we need your support. That's why I would like to thank Emmy and the Drug Free America Foundation for the support. But we, as usual, ask for more support. And at the same time, I would like to thank World Federation Against the Drug. Since we joined this international movement, we now aware of some movement, but we still need more to do more in our region. Our community and our people, they deserve more to be served by us as a civil society in Jordan. We keep asking for more support from you. I don't know which kind of support. You have the experience. You work with different region in Africa and Asia and in different region around the globe. So we are open to work together to support us in all aspects. And we really appreciate all the previous and the coming support. Thank you.
Thank you so much. Really, the cooperation is one of the main outcomes, or my takeaway here, and the importance of not leaving any region or person behind. So thank you, Musa, for stating that so clearly. Sana, would you like to add something as well before we close the session for today?
Thank you, Regina. Of course, I would like to at first thank Drug Free America Foundation and World Federation Against Drugs. And I would like also share what we are doing in Pakistan, especially we are talking about the youth engagement. All the panelists mentioned that how we can engage the youth. Especially Pakistan Youth Organization conduct different prevention activities with different educational institutions, especially the life skills training, different messages, different healthy activities like poster competition, like sports events, and other activities in different areas of life. So I think we, as the our other experts mentioned, that the different agencies also in Pakistan, they made the different seizures for the synthetic drugs. But being the social activist, we need to work on the prevention, especially the early prevention. We need to work with the school and university students so that we can prevent them from the synthetic drugs and other drugs as well. And thank you very much, the panelists and Regina, you and Amy for all these sports. And I would like also mention that hopefully we also did the different collaboration in the future as well. Thank you very much.
Thank you very much, Sana, and apologies for typing. I was writing down some notes from what you're saying. It really comes back to prevention, to youth engagement, and the importance of not only supporting, but equipping youth to learning about the places where we can meet youth. Like Sean mentioned in the beginning, it's, interconnected with social media, with gig economy. It's really something that we can see across the globe in different capacities. So we have a great opportunity here to learn from one another. But it's also about offering and making sure that there is equitable access to evidence-based and trauma-informed treatments and recovery services. And now I'm thinking, because we had a recovery webinar last week, we should have had that after to follow in this process. But for those of you who missed that webinar last week, it should be online. So hope you can have a look there. And really, I think what from my side, before handing over to Amy, what I bring with me is this idea that we need to take the next step. So how can we engage and cooperate together to learn from one another, to contextualize and to move forward to counteract this storm. I think we're doing a lot of good already. We saw that numbers are actually going down, but in leaving no one behind, we should continue to have these discussions. And without further ado now, I would like to hand over the word to the Executive Director of Drug Free America Foundation, my and WFAD's International President, Amy Ronshausen, to give some closing remarks.
Thank you. Thank you, everybody, for being with us today. And as usual, I'm honored to be able to give the closing remarks and shut us down for today. But what we've heard today, we were, exceptionally grateful to hear from experts here from the United States, from Jordan, from Pakistan, and the information that was shared was both very sobering, and I learn new stuff every time we do these webinars, but also very motivating. We've learned that this crisis is not isolated to one nation or region. We hear a lot about the impact to the United States, but as we've heard, nobody is immune to this, that this synthetic storm is sweeping the globe. It's disrupting communities, it's devastating families, and it undermines public health and safety on every continent. And I think that Musa shared information that really shows and showcases, how it's being utilized during a conflict era and in conflict zones. But what is also very clear and very powerful is that none of us are facing this alone. And that across this virtual room today, and I'm looking at the names of the people that were here and just the people that we work with every day, you all are leading these prevention campaigns in schools, conducting community outreach, running recovery support programs, strengthening law enforcement collaboration, and pushing for smart life-saving policies. The work that you're doing on the ground matters. And I want to take a moment to recognize that tremendous dedication that so many of you bring to the field, because while this is very real, so is our global capacity to respond. And we're beginning to see that momentum, as Sean showed with some of the numbers going down. It's nothing to have a party about for sure, because we still have so many people dying, but it really shows that the work that we're doing is working, and we need to do more, and we need to seize that momentum. And I think one example that came to mind is of our international partnerships is the work of the Global Coalition to Address Synthetic Drug Threats. That was brought together, started, I think, in the United States. A lot of different countries have signed on at this point, and they were able to bring together over 1,600 subject matter experts from 163 different countries to unite all of us on our commitment to lessening the impact of synthetic drugs on our society. And that level of engagement on a single issue, especially around drug demand reduction and supply reduction, is really historic. And it sends a message that this isn't just a fringe issue happening in one place, that it is a global priority, and that collaboration is really no longer optional. It's essential and vital in making sure that we address this issue. We also see the importance of public awareness campaigns that makes this crisis visible and understandable to the public. And Sean shared the DEA's One Pill Can Kill. And this is really, for me, a standout example of how we can put a face to the reality of counterfeit pills, because we see that that's such a big issue with our young people, and it makes it clear that one choice can really have fatal consequences. And campaigns like that need to be adapted and scaled globally, because that kind of education really saves lives. When it comes to overdose prevention, the solutions have to be comprehensive and culturally adaptable, but they don't have to be extreme. We see that the harm reduction movement is really looking at these very extreme strategies, they aren't seeing success with those. But what we are seeing success with is the community education, and that equips parents, educators, and the whole community and youth with facts and tools that they need to resist the drug use. Expanding evidence-based treatment, including medication-assisted treatment and behavioral therapies. Increasing the availability and the training for naloxone so that those who witness an overdose can act swiftly to save a life. We can't get people into recovery if we're losing them to a drug poisoning or overdose. Strengthening screenings in schools and primary health care to catch substance use early. On our call with the recovery call yesterday, and when we're working with our trauma-informed care strategies, we're talking about the need to educate physicians in the medical field so that they are looking at this issue and that they can do screenings while people are in there for their medical appointments. Also supporting long-term recovery infrastructure. It's not just about individuals in recovery, but it's building that resiliency for the entire community and having that community to support. And these aren't just technical interventions, they're investments in humans, right? And human dignity, and building that resilience and building that hope. We also have to remember that prevention doesn't start at a treatment center. It starts in homes, it starts in classrooms, in the community, and it starts before that first pill is taken. And Sean mentioned that sometimes this starts from a prescription drug that is shared. And so that prevention has to start at home, at the doctor's office, with that understanding that we don't take medicines that aren't prescribed to us. Sometimes, unfortunately, prevention is overlooked in global strategies. We're looking at things that get us the biggest bang for our buck, and sometimes it's hard to put an emphasis on something that may or may not happen, and it's hard to find a champion in getting that money to secure for primary prevention efforts, because it is a long-term investment. It's not something that we're going to see a quick turnaround with. But we need to uplift evidence-based prevention programs, not just as a support activity, but as the cornerstone of every national drug strategy. And I think the Oviedo Declaration talks about that as well, and something that I would encourage you to look at. And Regina mentioned, and so did Sana from Pakistan, that we have to make youth the center of what we're doing, not just looking at them as a vulnerable population, but as key partners in our solution. Young people have to be empowered with information, tools, and platforms to protect themselves and to lead the change for the next drug-free generation. The work that many of you are doing in youth engagement, training peer educators, integrating prevention into school systems, and giving youth a voice in policy is not just important, it's transformative. So what's next? Regina's talked about that. Let's not let this be the end of our conversation, but the beginning of a renewed global commitment, because when we see administrations change, when we see turnover in our field, sometimes we forget what we were doing last year. So we need to make sure that we're building on that. We have to continue to strengthen our cross-border intelligence and information sharing. We have to invest in prevention infrastructure, and we have to support family and youth and communities with sustainable resources and elevate the work that every one of you guys are doing on the front lines. This moment is for global solidarity, not just in words, but in actions. The storm may be synthetic, but our response has to be authentic and anchored in compassion, guided by evidence, and powered by partnership. And I think that that's something that we're very good at. We have very limited resources across our network, but look at the differences we're able to make when we collaborate and come together. So together we can shift this narrative from despair, because there is a lot of despair, right? We're dealing with families that are torn apart, regions that see very slim resources, but we can change that to hope, from isolation to unity, and from crisis to a coordinated response. Let's take what we've learned today and carry it back to our countries, our communities, and our coalition, because I think that, you know, it sounds silly, but the world is really watching what we're doing on this particular issue, because it isn't something that's just hitting one of us. And if we can show people that we can come together when we have so many other things that try to tear us apart, but we can come together on this one issue and really make significant differences, it really showcases the power of civil society and how those public-private partnerships can work together. So thank you again, everybody, for your participation and your partnership, but most importantly, your passion to put people first, because that's what really makes the difference in our communities. It's always a great honor for me to work alongside each one of you, and your leadership and your commitment to what you're doing on the ground really inspires and really is the heart behind the work that World Federation Against Drugs does and Drug Free America Foundation. So I'm just very appreciative for each and every one of you. Thank you.